Hi, Neighbor. I'm Jodie Jackson, host of the Hi Neighbor podcast.
Hi, neighbor. I'm Scott Clardy. I'm an assistant director at Columbia Boone County Public Health and Human Services.
Hi, neighbor. I'm Stephanie Browning. I'm Director of Public Health and Human Services for the City of Columbia and Boone County.
And I want to thank Scott and Stephanie for joining Hi Neighbor this morning for this conversation. We call the podcast Hi Neighbor because the world is a very small place. You know, we called it that 30 years ago. You run into somebody, and especially with technology 10, 20 years ago, you find out, oh, we've got more in common than we knew. Boy, world, it sure is a small world. And there's something about a global pandemic that really brings that out at this point. It really is a small world. And I had people walking by in front of my house who would wave and say, hi, neighbor. And I would shout back at them, and, oh, are you new to the neighborhood? And they say, no, and they live 4 houses down. We've never spoken.
Isn't that something?
Yeah. So I tried to have the concept really we're all neighbors, and maybe that might also help us treat each other with a little bit more gentleness and civility. I spoke just real briefly with Scott, Stephanie, before you came on. I said, so how are things there on Worley Street? And he says, well, they're really busy. And he made the comment that during the H1N1 pandemic a few years back, it was busy then, but not quite like this. Stephanie, can you sort of give some context to that, just in terms of resources and staffing now compared to then?
Well, that was quite a few years ago, and we've been very fortunate right now to have funding from the Boone County Commission through the CARES Act to bring on some additional contact tracers, case investigators, health educators, communicable disease specialists. So we've added about 40 new people, which has been fantastic and is starting to pay off. But if you think about it, during H1N1, we're pretty much operating today with the same number of staff that we had back then, maybe even a few less. I mean, we have not added staff over the years. We're a very lean organization in terms of, like, and if you look at how many people we have per capita, we're a very lean organization. So coming into a pandemic at a time when you don't have an excess of employees has really been a challenge.
And that was 2009, is that correct?
Right.
Okay. And just to give a little more context here then, that was 2009, 2010. Stephanie, you might recall, I came back from a week at the CDC. I was part of the Midwest Journalism Fellowship for health journalism. And part of that was giving us kind of a boot camp crash course with about a week at the CDC, and listening to Dr. Frieden at the time, the director there. And I'll never forget, and it really set me on fire really for health journalism, when he told our group of journalists, there were about 8 or 10 of us, and he said, the story of public health, when it's successful, it's not really all that sexy, because it's the story of the dog not barking in the night. And, we all kind of looked at each other and, you kind of instantly understood what that was, but it really was a little bit of a deeper meaning. Because when things are going well, nobody notices. And there you are at your shop on Worley Street, going about your business. And I want to talk later about all of the breadths of services that the local health department offers and provides. But when I came back and I shared that with you, and Sarah Rainey, I think, was with the epidemiologist then, and some others, everybody was kind of nodding their heads. Yes, that's exactly right. And the dog not barking in the night, it isn't the case right now, because there's a dog barking very loudly. What I wonder and am concerned about, and I'm going to guess you share this dog has been barking so long, so loudly, that people get used to it. And you're suddenly like, well, maybe it's not that big of a deal. Maybe it's not that serious. Scott, can you kind of take it from there and talk about the dog barking in the night, the COVID-19, and seriousness compared to 6-7 months ago?
Yeah, that's a good question. So I would say that you're right, that there's a large portion of the community that's experiencing COVID fatigue. And, they are tired of not being able to live their lives the way they want to. Believe me, everybody at the health department feels exactly the same way. But the fact of the matter is that, when the pandemic started in Columbia or in Boone County back in March, we knew very, very little about this virus, and we learn more every day. And quite frankly, the more we learn, the more frightening it gets. We're seeing studies coming out now that have indicated everything from there is a potential for reinfection, and the studies aren't clear, but it appears that as though there's a potential anyway to have serious symptoms even with a reinfection. But I think the more concerning thing is that we are seeing evidence that some people may have long-lasting health impacts, longer-lasting health impacts. We don't know how long yet because we're still learning about it. It's still happening. But even among younger people, we're seeing things like cases of myocarditis and that type. And when I say we, I mean the scientific community worldwide is starting to see this. And so it is still something that is very scary. The more we learn about, just because in Boone County we've only had 7 deaths doesn't mean that it's nothing to worry about. It's very definitely something to worry about, and that's why we continue to work so hard. And we find out more every day, and it's always concerning what we find out.
But Stephanie, let's talk too about the chronology of this if we can. Again, I don't want to rush through this, but I want to get also to the dashboard that you have, the hub of information, and talk about what those numbers mean, how we should interpret those, how maybe the experts interpret them compared to how John Q. Public interprets them. But the county's first case was when, and let me also ask, had that been anticipated? Scott says we're learning more about it. It was new then. When the first case came about, was that something that y'all were just kind of sitting, holding your breath, waiting for?
Well, I'll tell you what, I'll tell you a story from last night. So we had our first Board of Health meeting last night since March 12th. So it's been that long since we've met together. And as we were going through the minutes and from that meeting for the board to approve, our chair, Murray Scala, pointed out that in my director's report that night, I had said that we had been monitoring for weeks the outbreak of coronavirus, and that St. Louis had its first case and Springfield had already had a case, and that we were watching. And I think literally we got our first case the next day.
Wow.
Yeah.
Okay.
But I mean, what a flash from the past just last night to think it feels like an eternity ago,
Yeah.
But, it took us, I think it took us to get up to 100 cases. It was probably 55 days or so, after that first case. And then, 52 days later, we were at 500 cases. And, we saw spikes starting after Mother's Day weekend. We saw another one that came after Memorial Day, again after Father's Day, 4th of July, and as people got out and about in the summer and, gathered with friends and traveled and did, our numbers have gone up. And of course, since August 1st, that's like traditionally that weekend is move-in weekend here for students living off campus. A lot of times they start moving in that weekend. And since then, our cases have just really continued to increase.
Well, and let's look in just a minute at what the numbers are right now, the latest reporting. But first, help me understand, because I spend a little time on social media, and seems like there's the two prevailing thoughts are, hey, we need to really just listen to the experts, let the experts be the experts, follow the guidance. And then there's this other one that's maybe driven by COVID fatigue, maybe by the incredible political polarization of all this. Okay, so you said 100 cases went to 552 days, but people weren't dying. The hospitals weren't overwhelmed. There wasn't a shortage of ventilators. We talked about, well, let's flatten the curve so the hospitals aren't overwhelmed. And here we are 6, 7 months later. There's still not this scourge of deaths. Hospitals are still operating within, reasonable capacity. So it's easy then, isn't it, for the public to say, well, what's the big deal? Let us all get about our lives. How do you respond to that?
Well, I mean, we are blessed here to have an amazing healthcare system that has worked really well together. And they're on regular communication with each other, looking at how many cases, what's happening, so they're not at their capacity. They haven't had to scale back procedures or, they've managed what they've had. But, we've had 70 hospitalizations, I think 70 or 71 to date. But I think yesterday all hospitals had 52 cases. We're not their only source of hospitalizations. It comes from all the catchment counties in our area. And, if you, yes, hospitalizations are a very, very important factor. And if they ever had to scale back, that would be a great cause for concern. But, when you think about it, if somebody, for every case, is say that I have an employee that tests positive, they're going to be out of work for 10 days, right? That's 10 days that my employee is not able to work. Some employees aren't like us, blessed with sick leave benefits and things like that. They are missing out on income, maybe not having the ability to make rent. It's hard on employers to manage their workforce when they have employees out. And then if they've had multiple contacts in the workplace setting, now those contacts are in quarantine for 14 days. I mean, it's not just the hospitalizations. There's a very big picture that you have to look at.
And Scott,
could I add to that just a little bit?
Please.
Couple things on the hospitalizations. In March, all we had to base the experience on was what had happened in China, and we saw hospitals totally overrun very quickly to the point that they were building new hospitals as fast as they could. But also because we had that experience, we were able to be much better prepared than China was when it hit. And so I think that's one of the other reasons that maybe we didn't have as many hospitalizations. We were prepared. We knew more about what to expect about things like stay-at-home orders and how infectious this was. And then lastly, I would just mention too that I think one of the reasons we haven't seen as many hospitalizations as perhaps what have been seen in other parts of the state or in the country is because our cases have been predominantly young, and they don't seem to get as sick and need as acute of care as people who are older and get the virus. So I just would throw that in there too as a hospitals. Stephanie said it. Hospitalizations are important, but there are a lot of other issues going on here that are economic and social beyond health issues. So.
Well, and I hear frequently, and I'm sure you do too, people say, well, there've only been X
Right.
number of deaths.
Yeah.
And,
Seems callous to me.
what's that?
Seems very callous to me. There's only been.
Oh,
It seems uninformed, very uninformed.
Okay.
So,
Okay. Well, there's only so many hospitalizations, and then you get into the politicization and the polarization, and the people questioning, well, can we even believe what the CDC's numbers are? Can we believe what the testing is? I know early on there was a spread like wildfire, the rumor, the myth that, people were being tested multiple times, reported multiple times, that the antigen tests, the antibody tests were being counted as active cases, and that wasn't the case. So Scott and Stephanie, both of you would respond, I see the numbers, I look at the dashboard, I see the hub. What should be my takeaway as the John Q. public, when I see that? How should I interpret that? What should it mean to me? And how can I help others understand that in its full context?
Scott, you want to start?
yeah, sure. So I think when you look at our hub as, comprehensively, what you need to realize is, or what the takeaway message is that we are seeing extreme increase in cases, a significant increase in cases on a daily basis. And it is primarily among our younger age groups, specifically the 10 to 19-year-old age groups and the 20 to 24-year-old age groups, and even more specifically, the 18 to 22-year-olds. We're seeing significant increases in there. And that if you look at the numbers closely, I think you'll see that there is starting to be some more increase in some of the other age groups, but we think that could very definitely be related to the increase that we're seeing in the younger people, because those younger people don't just stay on campus. Most of them don't even live on campus, and they're out, eating in our restaurants and shopping in our shops and working in our employers' places of business. And so, you see a lot of disease transmission as a result of those kinds of things. So yes, it's mostly in our younger group, but we have a huge concern about the impact that's having on the rest of the community. I mean, that would be my takeaway from all the data combined. Plus the fact that we're seeing it increase in counties around us too. Maybe not at the rate that we're seeing it here, but it is increasing other places. So.
Yeah, and I would say, yes, we know we have this big spike in cases in that age group that Scott referenced, but we're also seeing some of our school age kids, those numbers going up in the county, and they're not even back. Columbia Public's not even back in school, but even in other schools, as they've come back, they've had to have some little pauses here and there, and so the other thing I think people don't think about is just how, like when you talk about the mode of transmission, and you'll see there's a lot of contacts to a case, and early on, our very earliest cases were almost all travel, right? And then it started to shift. We started to have some community transmission, and as that picked up, then we started having contacts to cases, and it seems like when you've got a case in a house, it's really, really hard to not spread to others in the household. It's whether it's a family member, or whether it's a college roommate, it takes the people I know that have done it well have really, really had a whole separate level of the house where there was absolutely no interaction. So, I think that mode of transmission is really important to keep an eye on.
And when you talk about the mode of transmission, fall coming about, college kids, the college population coming back, and now schools starting. Some are kind of staggered starting. Of course, Columbia Public School has this is totally online right now. I mean, this wasn't a surprise to anyone, right? I mean, we knew this was coming, and there was
talking about it for months.
Okay.
And
I remember when the mask ordinance, the mask mandate was being debated, and watching that conversation online, the Columbia City Council having that conversation and all of the public input. One of the big points of that whole conversation was, well, we need to get this in place before August 1, before the college students come back, so that this maybe can become part of our way of doing things here. And I've been downtown a few times driving through. I'm not down there socializing, but I've seen a lot of masks being worn. I hear other reports. I went to the mall and there was nobody wearing a mask, and I've been through there just for morbid curiosity. For one time, everybody in there was masked, but when it comes to the mask ordinance and the great debate on masks, people will look at the current transmission and case rate, and it's going up, and they say, well, the masks aren't working.
right.
So someone will inevitably go back and say, well, back in March or April, the CDC was saying we don't even need to wear masks, and here we are wearing masks. Government's just trying to control us. How do you respond to all that? Get through the noise to say, well, this is the science, this is the best practice, this is what we need to do.
Yeah, well, I'll tell you what, we're an agency that's always focused on prevention. That's at our core, right? And so, social distancing, wearing a mask, washing your hands, staying home when you're sick, you know, avoiding the gatherings. Those are all layers of protection and prevention. And so when I hear that, you know, well, every time that there's an increase in cases, somebody will inevitably send me an email and say, well, I guess the masks are really working. But what would they be if we weren't wearing the masks?
Mm-hmm.
Instead of a 221 case day, would it have been 500? You know,
Right.
I don't know, but it's the best prevention we have.
Okay.
And I would just add too that you're right, Jody. Earlier in the pandemic, we didn't think the masks were effective. But as I mentioned earlier, we learn more every day. And as time passed and we learned more, we found out that that was not correct. Once we had better information, more complete science, studies with better statistical power, we were able to determine that masks do help after all. And so we changed that. I think that I would not be surprised if we don't continue to see those kinds of recommendations evolve as we learn more. People have just got to get used to that, you know, that when something is novel, by definition, that means it's new and we don't know a whole lot about it. So we learn more every day.
Well, and I know I had a conversation with someone on Facebook, and actual conversation, not one of these things, you know, people are throwing nuclear bombs at each other. Yeah.
Mm-hmm.
And I was talking about, well, as I understand, this is why, you know, what I asked the question, what would it be without the masks? And they came back to me and says, well, I guess they'll want us to do this for influenza too. And I came back and I said, that sounds like a good idea to me. Well, because
good job.
Well, I am highly susceptible to influenza for whatever reason. My influenza at 8 o'clock in the morning, but 8 p.m. is pneumonia, just because of I have a scar tissue in a lung that never causes any problem. You wouldn't ever know it was there. But if I rake up wet leaves or get into moldy leaves or stuff like that, or if I get influenza, I'm in trouble. I get pneumonia, and I've not been hospitalized for it, but that's me. And I'm diabetic now, so I'm in that high risk group. I understand from a lot of research I've done on my own how COVID specifically affects diabetes and how it exacerbates glucose problems and tissue problems and renal, kidney things. But when I go into the store a year ago, this was before all this, I always I tried to wash my hands and take the sanitizer and hold it onto the cart handle as I was going through the store because I didn't want to get influenza. And for me personally, if wearing a mask then gives me an extra layer of protection, or for the people around me better protection, then I'm going to do that. And I don't think it's because I've caved into some conspiratorial government cabal that wants to control my life. Who wants to?
For you. Good for you. Yeah, I don't know that needs a follow-up. I mean, the issue with wearing masks is about protecting other people from yourself. That's when it comes to COVID. It may provide you some protection too, but the primary reason for doing it is protecting other people from yourself. You may have the virus and not even know it. So.
Yeah, and it's just such an easy thing. I mean, there's nothing hard about putting a mask on,
Well, March the 25th, stay-at-home order was enacted.
Mm-hmm.
Since then, there have been a few public health orders, probably the most controversial of which was the mask ordinance from July. I think that's when that was enacted.
City council.
Yeah. So the stay-at-home order came, and immediately, for that time and through April, local businesses began to suffer immensely, and still do. And when the mask ordinance went into effect, I think there were a few businesses downtown, especially, that just kind of said, "Well, this is the last straw. We can't do this anymore." Stephanie, you were asked at the one of the most recent news conferences or gatherings, I think it was a reporter who asked you, who asked you, did you workshop this latest order, which tells businesses to start closing by 9 and to be completely closed by 10?
Last call's at 9.
Last calls at 9. They said, did you workshop this with the local businesses? And I kind of had to scratch my head because I thought, well, when have public health orders ever been determined by kind of taking a poll or a survey of
Right.
of the businesses? And then I see others, they say, well, there's just been a complete lack of leadership here. And I know you've seen that, and I don't know if it just makes you cringe, or at this point you just shake your head. How do you respond to that level of criticism, and knowing that this has been devastating on the local economy?
Yeah. Well, in regards to the last order, when we were seeing those cases climb so fast, and we were getting complaints about crowded bars and no social distancing,
And we were getting pictures of them.
pictures being sent to us, and we were coming up on another weekend, I thought, this just cannot keep happening, and we're already at a point where our schools were saying they weren't going to open up online, and I'm like, we've got to push this down. And so, no, normally I don't go get the pulse of businesses before I do an order. I always talking to different groups and businesses, but you can't let that dictate what's right for public health. And I always try to think about the economic impacts and all of that. I certainly never want to have to go back to doing a stay-at-home order, because that was really hard. It was hard in all aspects. But so yeah, I think what I've tried to do with the last orders is trying to give people like 5 days notice. And this one I didn't. It went into effect immediately.
Mm-hmm.
So that really sort of caught them on their heels, and I feel bad for that, but I felt like it was needed,
Well, what about the businesses that say, hey, we're following the orders, we're keeping social distancing, we're insisting on masks and so on? Why not just penalize those that are not complying? And I don't know if that's generally true, or if it was kind of like everybody was out of compliance.
No, I think you're absolutely right. There are a lot of businesses that have really tried to space things out, do things right. And I think that as we think about, and that was one of the things at our last city council meeting that the mayor asked our city councilor, was, would it be possible to just go after, like, pull a business license when somebody's not complying? And I don't think it's all that easy. Her answer to that didn't make it sound like they could just say, okay, you're not going to get your business license is pulled and suspended for the next 4 days or 5 days, or didn't sound like it was all that easy to do.
Okay.
But,
Yeah, and Jody, I would say, I'm sorry, Stephanie, did I interrupt you?
nope.
Okay. I would say that we have penalized some of the businesses that are bad actors. Our website lists places that have been issued notices of violation and violations. And so and then from that point on, it's up to the city prosecutor to determine if he wants to file charges, and then it goes to municipal court. And I know he's done that on at least a couple of these. And so we try to do that where we can clearly show a defensible case that they did violate the order. So we have done that.
The interesting thing, a lot of people, like, as we've had the restrictions on hours, one of my worries was that we were going to see an increase in the number of house parties and things like that going on.
Mm-hmm.
But, the complaints for those have not gone up.
Really?
Yeah, which is really interesting to me. I'm very glad.
I remember, because I'm on the nextdoor.com site, where neighbors are kind of watching out for each other. And I think that's generally pretty civil, and it's useful, valuable. But I know way back, and this is probably, early April, somebody had said, hey, the police just showed up at my house because somebody had called and said we were having a big party or something. and it was just the 3 or 4 people who live there having a cookout on their back deck. And somebody made the comment that, well, it's so quiet now that, somebody 2 blocks over may be hearing something that they wouldn't have heard otherwise. And it's something that we had noticed, maybe not quite to the extent now, but there was less noise, there was less commotion. And I don't know, I kind of took that as a positive thing. And I sure don't want to say that to undermine or minimize someone's pain, because I was telling Scott before you joined us, Stephanie, that, I try to be really cognizant of the fact that Kelly and my wife and I have not experienced this the same way that a large majority of people have. We don't have kids at home. We have our own businesses. We can work from home. We have been able to just by natural means avoid some of the real challenges that other people are having. So,
Right.
And I sure don't want anybody to misinterpret my comments and my comments to you that, we're without empathy or compassion for those people, because those are our neighbors and that's our community. And it's, I think now it's even cliche to say, well, it's unprecedented because this has gone on for so long. So we talked a little bit about how we got here and what's going on now. When do you have a forecast, a magic ball that would say when we're going to be post-COVID and what that might look like? When are we going to be past this?
I wish I had a magic ball. I mean, even let's assume that we get a vaccine sometime in the near future, right? By the time they make enough vaccine to get it out there, probably what will happen is limited vaccine supply will come out, and it will go just like H1N1 to certain segments, be prioritized populations. By the time you've actually manufactured enough vaccine and have it readily available for anyone, it could be,
At least next spring.
that's what I was going to say, and then, hopefully it's an effective vaccine, but, every year you need to get a flu shot, right? And I mean, it's recommended, you don't have to, but we recommend it.
Yeah.
But, some vaccines you get, you develop a good immune response and it lasts with you for a long time before waning. And we don't know how this one will be. So, I mean, I think we're always going to have to be mindful,
COVID is here now, and it's going to stay here. Okay, it's not going to go anywhere. It's not going to go away. Just like H1N1, it never went away. It's just, you see that, at least I've seen it in every flu vaccine since 2009. H1N1 is the predominant strain, or one of the predominant strains. So COVID's going to be similar. I mean, it's not going to disappear off the face of the earth. It's something we're going to have to deal with for the rest of our lives. And so hopefully a vaccine or vaccines will be developed that will help. But we also know that we have people who will not get vaccinated. Mm-hmm. And so, people are going to continue to get sick from it. But I think that the pandemic issue, I think it's with us until we get a good vaccine and we get good uptake of that vaccine. I think that's the future until that time.
I saw somebody the other day post, it was a tweet maybe like, wow, remember back in March, like 12 years ago? And it seems like this has really been forever. And I say that to the 2 top public health experts in the county and city here who, of course, it's been here a while and it seems like it's been a long time. And now, Scott, you say, well, at least till next spring before there's a vaccine, and who knows how long after that before it's effective and we get better coverage of immunity in our community. But
Jodie, with the vaccine, I mean, the ones I'm hearing about last night mostly are a series of 2 doses. So you'll get decent coverage with 1 dose, but you're not going to be really covered as well as you'd want to be. And our experience with that is that a lot of times people will come and get a first dose and not come back for the second dose. So that's going to be another issue with the coverage for this vaccine. It's going to be an issue.
I'm going back to late March, stay-at-home order on the 25th, and I think it was about 3 or 4 days later, we realized here in our home that we were out of Diet Coke.
Oh my gosh, the drama.
Well, and I'm using this now because I've been thinking about this for a while, and it seemed kind of funny, and now it just seems so crazy trivial. but I had this great idea, and Kelly says, well, you know, and we had just gotten a delivery of groceries, I think, from Hy-Vee, you know, and didn't want to go out, wanted to comply. You know, my wife is a rule keeper by default, by definition. I'm not so much. But I came up with this great idea. Well, we don't have to go in anywhere. Let's just drive through the county, because there's got to be an outdoor vending machine somewhere that has Diet Coke. I can tell you this, because I remember growing up, you know, late 70s, 80s, even 90s, you could go there, outdoor vending machines everywhere. There are not anymore. And we left, and Kelly says to me, well, you know, we're not supposed to go out. And I said, well, let's just be renegades, you know.
We need our Diet Coke.
But I said, I'm going to have to ask Stephanie about this at some point, because I would deem this was medically necessary. And because I don't drink coffee, that's my caffeine. I cannot have a Diet Coke. I got one beside me here. So, but we drove through Hallsville, we drove through Centralia. I think we went up to Sturgeon. We drove all around, went to all the stores. There were no outdoor vending machines. We got back into Columbia, drove by on the business loop, Mosier's. That's a mile from where we live. We should have started there. They had outdoor vending machines. They had a Coke machine on the east side of the building and a Pepsi machine on the west side. When you know it, the Coke machine, I don't even think it wasn't even plugged in. It was empty.
Oh.
So I had to settle for a Diet Pepsi. But, you know, we look back at that, and that seems like, it was like 9 or 10 years ago. It just has been so long. Scott, you brought up the term COVID fatigue. What's your advice, your recommendation to people who are feeling it so strongly, and now they're home with their kids, maybe trying to work with themselves, their kids are there, there's some tech problems going on maybe. Well, it's just like one thing after another. What do you say?
I say those issues are real, and the struggle is real, and you know, I get it. I understand that. What I tell myself when I really want to go do something that I know I shouldn't do, like go out and eat maybe, or you know, I love to go to St. Louis and do stuff in St. Louis. St. Louis County has some of the highest numbers of cases in the entire state. I tell myself, you know, you shouldn't be doing that, because not only could you make yourself sick, but more importantly, you could make somebody you really care about sick, and they may be vulnerable. My dad is in an assisted living center, and his health is going down week by week by week. I've not been able to touch my dad since March. I've communicated with him through a window since March, and so it's extremely difficult, and to be able to see him visibly deteriorate, and me not be able to at least go in and hold him or talk to him face to face, it's hard. It's very difficult, and I really want to go in there and talk to him, but I won't do it. And of course now they for a long time they were shut down. You know, they were closed off where you couldn't go in. Then for a little while they let you go in, and then there were serious problems with a long-term care facility in Jefferson City. So this one, which is in Callaway County, they shut it down again when we can't go in. But even when we could go in, I wouldn't go in, because I didn't want to do anything that could make his time left on this earth even worse. So I think that's, you just ask people to appeal to their concern for others more than their concern for their what they want to do themselves. And I don't want to say selfish desires, because I don't mean selfish, but I mean put the term, or put the emphasis on the good of others instead of your own good and what you want yourself. when I think about things that way, it's a lot easier for me than, to not want to go do things that I really always wanted, I enjoyed doing, and I wanted to continue to, but I couldn't stand the fact that maybe, I would end up in the long run giving this to my dad and it leading to his death, or
Mm-hmm.
a much lower quality of life than what he already has. So that would be my advice to people, is think about others before you think about yourself.
I appreciate you sharing
And I
that.
don't mean to be preaching when I say that. That's what I do. That's what helps me.
Well, you're sharing that from your own experience, and I think you've really humanized the data. It's so easy, I think, to see the numbers, see the dashboard, and you don't see people, you don't see lives. Stephanie, COVID fatigue, how do you handle it for yourself, your family?
Well, I'll tell you, the first few months was really, really difficult because, one, we were working, Scott and I and a lot of our staff were literally working 7 days a week, and it wasn't uncommon to be rolling into bed at 11:30, midnight, and up again at 5 a.m. and hitting the road. So, I think we've all had to learn to step back and try to take care of ourselves a little bit, but so like Scott talked about his dad. I had my fourth grandchild this summer. It was born in July, and my daughter and son-in-law live up in Trenton, Missouri. And so they needed us to come up there to watch their son while they went to the hospital. And so I felt like I was saving myself just so that I could be okay to be there for my daughter. But I've gone a long time without seeing my grandkids. I understand it, and it's a good thing to have FaceTime and all those wonderful technology things. But I do. If I'm going to break out of my bubble, I got my work bubble, I have my husband in my bubble at home, and if I'm going to break out of the bubble, it's going to be to see a grandchild. And yet, it's going to be very. I'm keeping my distance from the older kids, but I'm getting in. That's going to be who I'm going to break out of that bubble with. So, it's just a matter of finding. I'd love to have all my friends over, but right now it's just not. It's not the right time.
Yeah, I'm going to ask both of you in a minute to kind of give me a final takeaway for myself and for listeners, and maybe to think about a question that I haven't asked that you would like to have asked, or something else that the public really needs to understand. But I wanted to try to kind of lighten the mood here a little bit. I'm going to show you this package. I ordered Kelly a Christmas gift last November. I ordered a mug that says "Be Still." It's after Psalm 46:10. Be still and know that I am God. And it's a sign, it's a verse, a slogan that she has in her office where she does counseling. And so I ordered it in late November, and we didn't get it until sometime late February. And when it arrived, I very carefully looked, and I don't know if you can see it here. It came from Wuhan.
Ah.
Yeah, and it was mailed on December the 21st. So it came from Wuhan, and by all accounts now, the virus was in full swing there. Maybe had been a couple months.
Absolutely, yeah.
So I left it in my car. I wasn't even going to open it. And of course I went to the post office. I said, hey, I told them about the package. Would it be safe to open? They said, oh yeah. And Ellen at the post office said, yeah, just put it in your microwave for 15 seconds. That'll take care of it.
Yeah.
So interesting thing. About 2 weeks ago, my neighbor across the street, Ray Janasek, retired postal guy, he texts me one morning. He says, hey, I found something in my lawn, in my yard, that's addressed to you, and there's a coffee mug in it. Well, what had happened is, shame on me, I'd left my car unlocked.
Oh.
And there had been a string of car thefts, people going through cars. One car, actually, a few blocks away, was actually stolen. But somebody had gotten into the car and had opened this. So they'd already opened it, and I thought, good for you, you've got COVID. That was mean. But he said, I put it all together, it's back in your mailbox. So it was already opened. this was so funny to me because it's supposed to be the mug that says "Be still."
Oh,
Instead, it's from Hamilton. Just you wait. And I thought, well, ironic. I did wait, but that could be taken to mean so many different things. What was most stunning to me was that stuffed inside the mug is a KN95 mask.
what?
Yeah, and you see it here.
Yeah.
It's got the little. It's KN95s. Anyway, this is like the real deal. And maybe whoever stuck it in that mug was thinking, well, good luck to you. Good luck from Wuhan. I don't know. So just you wait. And boy, how fitting that is right now, because we're still waiting. We just had a little bit of a laugh here together, but we're still waiting. And so Scott, Stephanie, whichever one of you wants to kind of go first, what's the takeaway that if somebody's listening to this or watching it and they only really hear or take away one thing, what should it be? And if you can think of any other thing that you say, well, Jodie, you should have asked this, what would that have been? Scott, you want to start?
Sure. I think my takeaway would be that these are unprecedented times. We all know that. None of us have been through this before. There is not a playbook. Everybody is doing the best they can at all times. And so I think more than ever, it's important that we just allow grace to people at times. Everybody, we ask that we be allowed some grace, and we need to allow grace to people ourselves. And so, we're all in this together, and politicizing it and polarizing it, or making it, polarization of it isn't helping anybody. I would say that, and that we certainly appreciate everybody's cooperation who's been helping us out.
Yeah, I would have, Scott used the exact words I was thinking, that we all need to show each other a little grace. I don't know. I think that for me, one of the things that's most important is we have the ability to prevent this disease, right? It's in our control. I mean, we can wear a mask. We can keep our distance. We should assume that everyone around us is possibly infected with COVID-19. And if you knew knowingly that the person that you were standing near was positive, you would take very different steps. We should just treat it, don't go to work when you're sick. Don't, take care of yourself. Wear your mask, socially distance, wash your hands. That's all in our control. We can do this.
Okay, thank you. I should have given us a brief break earlier to let everybody know that Hi Neighbor is produced by J3 Content King LLC. That is my little copywriting and web auditing business. And it's produced for thepandemicpress.com. And this episode is sponsored by Kelly F. Jackson Counseling at 2401 Bernadette Drive in Columbia. Kelly reminds us that we can have and find peace and sanity now. Yes, even now. And we all have different ways of finding some measure of peace and sanity during COVID-19. We are all in this together, but we don't all react the same way. Just like other profound effects on our life, a moment-to-moment approach is one of the best ways to stay grounded and to feel empowered. So Kelly is asking, what are your tips and tricks to latch on to peace and sanity now? You can see her list of ideas and tips and tricks for achieving peace and sanity now at www.thepandemicpress.com. You can submit your own tips, and let's grow this list together. You can also learn how you or your business can be a sponsor for Hi Neighbor. Drop me a line at hineighbor@thepandemicpress.com. Scott and Stephanie, we went over the time that I had begged and pleaded you for, and you've been more than gracious to give me your time. Great conversation. I'm sure it will continue, and I hope we can follow up, even in a few weeks, and have a much more positive outlook and be talking about post-COVID.
Wouldn't that be great?
Wouldn't that be awesome? Yeah.
Thank you both.
Thanks, Jody. Thanks for the opportunity. Take care.
Thank you.